будинок один, і мій син хворий на рак. В нашій країні йде війна, але в нашій сім'ї вона окрема, за життя нашого сина. Держава мала купити ліки, але ви підняли ціни на ліки на 60%. Ви не лише не зробили знижки для нашої країни в скрутний час, але й вирішили додатково заробити. Це підступно, це морально, це вбивче. Ми не просимо милосердя, ми просимо подати ліки за старими цінами. Не заробляйте на чужому горі та скруті. Допоможіть моєму сину виграти війну за його життя.
Если мой сын не будет делать диализ, это угроза для его жизни. В этом году украинские фирмы, международные компании и их посредники продали государству лекарства на его лечение на 300% дороже, чем в предыдущем году. В отделении вместе с моим сыном находится еще 30 детей. Как мы, родители, можем выбирать, кому жить? Я вас умоляю, не зарабатывать дополнительно на украинцев в такое тяжелое для нас время. Позвоните в ваш украинский офис и спросите, почему цена выросла только для нашего государства и кто на этом зарабатывает.
Мы все привыкли, что фармкомпания зарабатывает на больных людях. Но то, что сейчас происходит в Украине, можно назвать фармгеноцидом. В то время как государство нашло средства купить препараты для больных людей, фармкомпании подняли стоимость своих препаратов до 300%. Без аргументов и причин. Они решили нажиться во время хаоса и войны в государстве. Я обращаюсь к вам, от всех пациентов Украины, повлиять на ценовую политику ваших офисов, ваших представительств, чтобы снизить цену до уровня возможности нашей выжить.
That was a short statement. It's for journalists, but also it's pharmaceutical companies that work all over the world. What is our press conference is about? Such a fact which had happened to Ukraine. Every one of you can go to a drugstore and buy vitamins. They could be expensive, very expensive, but those are vitamins. But when preparations turn into gold, and you understand that you don't have enough of money, not just to fix your health, but to feel better. But you understand that you cannot afford to buy medicine which will save the beloved. You face the fact where to get so much money. Today, all Ukraine is facing the choice. All people who will come to hospitals, they could face such a choice. Go sell everything, only that, and then you will live. There are those who are responsible for this in this country, and that is a responsibility is personified. That it has a name. Pharmaceutical companies in our country in this year, when we have the war, when we have no money, when Ukraine is on the way of evolution and a choice how to live better, they raised the price up to 200%, not by 2%, not by 7%, but not 10, but 200%. It means that you come to the bread store and a piece of bread doesn't cost 5 hryvnia, it will cost 200 hryvnia. Just imagine for a second what it means. So all of us as patients, we are facing a very difficult situation as we are like captives. They take the opportunity for us to survive in Ukraine. Here's the names of these companies. This year, in spring, patients of Ukraine, together with the partners, absolutely every pharmaceutical company sent a letter, and we asked, this year, when don't raise prices higher than they were last year. Only then you can save people. In case you don't do that, people will be without medicine. That was a cry for help of many organizations because of one simple reason. We knew exactly that technically, if these companies raise prices, then there will be no trade in this country. There are companies that are ethical. They did such a step, and they are in the corridor where they will have no profit in this country. We respect them because they have enough but there are these companies. This is not the complete list. There are some companies which are in oncology, and I don't want anyone in this country to to find any economic excuse for them. These companies on their own in this country, they can write a letter to the Minister of Healthcare, and that they change their opinion, that they will sell to the Ministry of Healthcare preparations by the price of the last year, and then there will be social position. That will be a social position, and people have medicine. It's in Ukraine. There is no money, physically money, to buy more medicine. As someone who lives in this disease, I know the situation people get into. They will have to sell their apartments because the golden medicine is very expensive, or they have to leave Ukraine. They don't have an alternative. We, as patients of Ukraine, we know that in case all these companies, and in press releases and press announcements, if they don't help Ukrainian patients, they don't have an ethical right to sell their products in Ukraine. No. They have their offices in the US, and they say that they want to help Ukraine. They have their office in the UK. They don't have production in Ukraine. These are all big brands. And because of unknown reason for us, during the war, they decided to make money on patients, on ill people. There is no economic reason, economic reason for that. They have enough of money. Not to make money on, not to rip people off. People have the right to live, to stay alive. What we want from these companies is to make a step to these people, or to leave this country forever. This is a very easy test. Do they deserve to stay in this country or not? Just because of a simple reason. If, because of the financial policy, people will die, they don't have the right to stay here. We hope that as a result of our statement, which we sent to all head offices of these companies, and we demand that these companies, on their own, they should send a letter to the healthcare ministry that independently on their ministry, dependent on the ministry, that they will send a letter, they will provide to create preparations by the price of 2013. Only in that case, Ukraine will be able to provide medicine to ill people in Ukraine, and all the people who need this treatment, they will survive, and that is only in this year. That is just a request, a big request for the sake of these people, and these companies absolutely autonomously, independently can take such a decision. There were such precedents on companies when they won from the a lot for $400 in the Ministry of Healthcare. They made a decision to sell those preparations for $80. There is no obstacle for these companies to do that. Why do we want that? Because the Ministry of Healthcare, I understand that they don't have money because of bad management. They spoke to the cabinet ministers and they asked, let's buy less medicine, 60% less. And for example, we have 100 people here. Just imagine, we will know that 60 of us will die. So this is a financial policy. We cannot afford that. To prevent that, to prevent all the treatment, not to the failure of all the treatment programs. And there is one recipe for all the companies which sell their medicine in Ukraine. We can close the eyes on the prices in drugstores, but this is a state trade. It's not a market. It's not a stock company. This is the state ministry. You cannot come with the market price to the ministry. Why? Because behind then in hospitals there are people who are waiting for medicine, and they don't have that medicine. This is just a very simple human choice, and we believe that all these pharmaceutical companies, when they see our letter, when they see the list we publish, and they make a decision, and they will decide whether they will help Ukraine or they will just make money on it. But we tell you that all those who make the decision to make money will do maximum for their offices not to be even in this country. Thank you. Lawyer Olena Shcherban. Lawyers of Anti-Corruption Center, we participated in all the procedures related to preparations, how to treat hepatitis, etc. As a result of investigation, we saw that prices are not higher without any reason. I have a table with the prices of pharmaceutical companies for today. Prices alternative in other countries of Europe and EU, and prices in 2013. We can see that in this table that prices are high compared to the prices of 2013, and alternative prices by 50, 30%, 200% higher prices.
For certain drugs, it's very difficult to say today why this situation is so presently, and the conditions of war and such urgent need in drugs, Ukraine cannot procure such expensive drugs. And we consider that we have enough grounds to approach the Anti-Monopoly Committee to check the facts, the cost chain, the cost estimates, and the exceed of prices specifically in Ukraine. We think that the companies decided to abuse the situation that we have in Ukraine, and we can call it pharmaceutical looting. But how should badly ill people deal with this situation? Well, we would like pharmaceutical companies to sell drugs at the prices of 2013. And the pharmaceutical companies and the Ministry of Healthcare share complete responsibility for death and lives of the people. So we've discovered yesterday that the Ministry of Healthcare canceled some bidding procedures because of the hyped prices that are not in compliance with the new bids. That means that we will have new bids. And if pharmaceutical companies come back with the exaggerated prices, and this is happening right now, we will have to downsize the scope of procurement by 2 or 3 times. That means that much fewer people will receive treatment. So in order to avoid this and prevent this situation, we think that presently pharmaceutical companies, manufacturers that Dima pointed to, have to provide cover letters, not just for some humanitarian aid or charitable aid. This should be a cover letter that is their commitment to provide drugs at the price of 2013. We would like prices to be not lower than in the EU and the same as we had in 2013, because according to our monitoring of past years, we can clearly see that the prices of in Ukraine were much higher than in the EU. So I think we can stay at the prices of 2013. It's feasible, and it is enough to provide for necessary treatment of all the Ukrainian patients. Oksana Korchinska, head of Guardian Council volunteer organization Living Tomorrow, Still Living Tomorrow. This is children's oncology. The situation currently for us as volunteers and activists in patients' organizations, the document that we obtained yesterday shocked us, because with this document, the Ministry of Healthcare and the person at the helm of the ministry, Mr. Musi, justify for this exceed of price up to 350%. Automatically, by the same document, they decrease the scope of medication down to 53% without any bidding procedures and without any collection of new evidence for the inventory. So all the public and patients' organizations who would like to approach the minister, we want him to withdraw his support of this resolution, because that will cut the number of saved lives by 2 in Ukraine. in the best case scenario. So you'll see the press release, and it's of the 31st of July 2015. It's number 2001/1/426. It's a very important resolution. It has been income and is signed off by Minister of Justice, Mr. Petrenko. So we are sure that the corruption mechanisms are present there. I'm a member of task force model on oncology. With our colleagues and comrades, we had negotiations for 3 months with the price to go down with the pharmaceutical companies. GlaxoSmithKline, Sherembei, they decreased their prices, and they entered the prices of 2013 because they met the Ukrainian patients midway. Companies like Roche, companies like Medic, Abeva, unfortunately, MDC, and all of them exceed at least at the level of 37, some to as high as 207%. Now we can see, according to this resolution that was offered by the Ministry of Healthcare, such companies that agreed to bid at the price of 2013, we can call them fools now, because they met the public midway. The companies that sat in waiting, and they were in the ambush. They were waiting for the bidding procedures to start after the negotiations with the company. So we waited for the talks, and we hoped for productive prices. On the contrary, the majority of such prices are criminally higher than normal. So this resolution in this case is a call to legalize the situation up to 53%. With others, we can negotiate. And our patients, and that includes oncological children, and the budget that we have for this year is going to downsize, to shrink, and the productivity of its execution will be more than 2 times less. So in the hospitals, children won't be able to obtain their treatment, only 30 to 40%. This is one of the most, the progress most provided for that. So the ministry's bureaucrats warned us that there was a special foundation of state lotteries. Last year, the amendment was made that the expenditures were for ecological children. For 6 months, they would talk about this fund, and 200 million for children. Yesterday, at the task force meeting, officials from the economic department, Ministry of Healthcare, said that it wasn't yet known whether this special fund was going to be employed. That means that instead of 315 million, we'll get, in the best case, 143. So we'll just hope for saving 10 to 15% of lives and their children. So we would like mass media and all activists to support our approach, so that the cabinet listen to the patients' organizations and seriously ill children of Ukraine. Thank you. My name is Volodymyr Zhovtyak. I am from All-Ukrainian network People Living with HIV. I'm here today to say that the disaster has already happened. The disaster in our medical care system with HIV/AIDS, the situation with public procurement will maybe much better than in other programs, with other programs. Yes, HIV/AIDS is a realm where we have NGOs active, people living with AIDS as an NGO, doing procurements of antiretroviral drugs. We've done that for more than 5 years. At more than $25 million, we've done that. And now we are buying them. We are having this bidding for, according to the international procedures, under which we'll procure more than $10 million in equivalent. medication, that is. And we can see that pharmaceutical companies, even according to our bidding procedure, when it is concluded, pharmaceutical companies are prepared to decrease their prices further through negotiations. They're prepared to provide them free of charge even. And now we can see that the same pharmaceutical company in different areas with different diseases can behave differently. We can see that the Ministry of Healthcare, it's not the Deputy Prime Minister, Special Deputy Minister, or other Deputy Ministers cannot provide for the necessary procurements. Those of drugs. We are frustrated, we are upset because the Ministry of Healthcare have found no other opportunity but to increase the procurement prices. And the Ministry of Healthcare have submitted this offer to the cabinet. It's not humane. It's inhuman the way we see it. For the Ministry of Healthcare, this is the opportunity to take their own decisions. Who is going to live in this country and who is going to die without any imaginable responsibility? And it is expected that this resolution will stay effective till the end of this year. This will bring about crisis in the sphere of public health care. And we see that this resolution will increase corruption in the Ministry of Healthcare. And we were overwhelmed when we got to know that the Ministry of Healthcare, in his memo attached to the resolution, put it down that draft resolution does not contain any risks of corruption. We disagree with that strongly. Draft does not require any public discussion. We disagree. Again, we are convinced that only with participation of patients and the general public we can obtain a desirable result. We can buy more at lower price. And we are sure that there's another way to provide for our people. It's the crisis center. The war is raging in Ukraine. And we know for sure that last year at specific positions procured by the Ministry of Healthcare, they exceeded prices from 30 to 70%. We know that that was the money that was simply stolen. And now we can see suggestions to increase the price to again create this corruption opportunity, corruption component. We are approaching the pharmaceutical companies. Please approach the Ministry of Healthcare and lower the price, make them do that, and we are approaching the Prime Minister. Don't adopt this resolution without any public discussion. Thank you.
The last statement. All the pharmaceutical companies that are here, they will receive a letter like this, and we will put a golden tablet, the symbol of greediness of the tradition in Ukraine, to make golden toilets. And here's one more bad tradition, to make golden medicine. And they deserve that, and they can correct this situation. And they have practically 5 months and a half to give to Ukraine, to the state procurements and price of preparations, which will save millions of Ukrainians. That will be not the issue of humanitarian assistance. It's of humaneness, and they live in our country. If they don't do that, people will die. They understand that, and I hope all the patients of Ukraine 19, then pharmaceutical companies have enough of common sense and responsibility to prevent such a tragedy. Questions? Any question? Ministry of Healthcare published the methods of calculating prices. Instead of a conflict with the producers, maybe it's better to make calculations better, and that will speed up the process. And it will help to unblock the tenders. I doubt it will help to unblock tenders for this year, because the regulation of the Cabinet of Ministers obliges to make calculations during 2 months. It will be in September. We need medicine now, and proposals for prices are higher. The formula should be transparent, and reference prices should be reference prices, and the formula should be correct. And we'll participate in that, and we'll provide to the Minister of Healthcare our recommendations and our wishes. But today it will not save the situation, because now there are proposals. What the supplies, prices for supplies, even for wholesale prices, they have no hope. There is no hope that this regulation will help us this year. And even if there is no Minister of Healthcare, just if they don't interfere. For 20 years they were successfully making money, and this is the only year when all patients asked them to understand that, save people, and they will send just one document. It will come to the ministry, and people will have medicine. That's it. Thank you very much. Is there any question? Oksana Shcherban. Clarify, please, how many tenders were cancelled? Because you speak about 8 companies. How many tenders were cancelled, and purchase of which medicine were cancelled? A vaccine for children. Those are preparations on the table. They were not cancelled yet. You have to understand that. It's Ministry of Healthcare has started to stop tenders because of higher prices and other reasons. Now they stop tenders for vaccines for children and preparations for some other diseases. And tender committee doesn't hide that they are quite open. They cancel tenders, though politically they have, there is no need to cancel. They can accept all the winners and they can continue negotiations. But because they are afraid, they don't want to take responsibility. They are ready to put responsibility on anyone. We are in a bad situation. We are catch-22 situation, and the only variant is pharmaceutical companies, and they should not blame others. So they should make a decision on their own, publish it, and they should show documents how they will show they will help sick people. But unfortunately, there are working groups in the Ministry of Healthcare who, because of influences, they decided to recommend a tender committee to review applications and to cancel the number of medicine. And some groups agreed with that. Clarify. A decision of the Ministry of Healthcare, Oksana mentioned. Give us more details about that document. What kind of proposals are there? What are you against? What are you against of? Now you'll receive. No, you received an explanation. That's not the complete document. We have the table and the logic of calculations and what is the plus inflation plus VAT. That's the margin, and they say clearly that they're not going to discuss this document with the public, And that regulation is registered in the Cabinet of Ministers, and tomorrow probably they will try to get the support. How will it influence on common people? Automatically, that regulation, then there will be no need to review tenders. If the price is higher up to 50%, they automatically accept that price, and the number of medicine will shrink by 53%, and also, of course, the number of patients that receive that medicine will be shorter. This regulation allows the ministry to correct applications. Applied prices for different medicine, and they don't need to discuss these issues with civic organizations or patients groups. That chaos we observe in the Ministry of Healthcare, we have not seen it for many years. And we are afraid that those public servants who have no responsibility for their words or for their actions. Why do we say this? Because from March, many times they promised us, and they didn't meet any promise. So we are afraid that because such responsible people, they will take a decision. Not only about 53%, but 65%, because plus 12% of inflation is added to that formula. So they will decide on their own what to pay more, for what to pay less, and there is a big corruption component of that, because we know if to compare with the previous year, the prices were higher. 70% higher last year, and such percentage, we can see minister or deputy minister, they can decide that they can buy medicine, and the price could be higher like that. But if the price is higher, it's not the only method to provide all who need treatment in the framework of state programs. This method will allow to kill half of our people. Thousands of people will die daily. That's much more than many more than war is taken. More lives that what is taken. Pharmaceutical, it depends on pharmaceutical companies whether prices will be high or not. Prices. They will pay this money. They will. So these prices for this year, they will influence on prices for the next year. So it's important to preserve prices from the last year, and they were even higher. And tax and inflation, VAT, and inflation didn't influence. There are some facts, and for some preparations, there were proposals to sell them cheaper than in the previous year. It means that for some preparations, nothing influences on some medicine. So we would like to have a clever explanation. We demand from pharmaceutical companies to stick to the price of the previous year. Thank you very much. Is there a question? Two short questions. Tell me, please, what's the root of evil? Pharmaceutical companies who would like to get big bucks, or Ministry of Healthcare, which should regulate relations. And the second question is, what's your concrete plan or actions in addition to letters to pharmaceutical companies, how to overcome these phenomena, how to deal with this? A tender committee, we should take something, not medicine, Why do we appeal to pharmaceutical companies? Because of one simple reason. Because this at the beginning of the year, and we told them if they don't change their financial policy for this year, there will be tragedy with purchases, and they knew about that 6 months ago. And there are pharmaceutical companies which played their social mission in Ukraine. They came to the market with the prices lower than in 2013, and then there are companies which came with a price which is 200% higher. It's not a fluctuation of prices or currency. It's a problem with their mentality. So for procurement, for public procurements, those pharmaceutical companies that participate in tenders of the Ministry of Healthcare this year, they should make a humanitarian step. They should give prices from the previous year, and then treatment program. They will have enough of medicine for patients, which. If that doesn't happen, we spoke to the Minister of Finances, Economy, to the Cabinet Minister, to the Parliament, for them to give more money, to budget more money, and it doesn't happen because of the war in Ukraine. All money goes to the war. Pharmaceutical companies cannot be blind to the war. They understand that the situation quite well, and if they cannot help there or somewhere else, the only place where they can help to Ukraine, that is, they can help treatment programs. So we ask them to help, and that's it. Of course, they could give a blind eye to that, but the question is, does it make sense to keep them in Ukraine, like Yanukovych? Thank you. The conference, when you invited pharmaceutical companies when they signed their memorandum, how many of them? There were 40 people. How many of them keep the same price during the round table? More than 70% of the companies signed a memorandum that in Ukraine they would sell preparations with the prices of 2013. We don't have all data, but by the trends we see that are small, but there are some companies and comparing with prices, they have the same price. And there are some, for some medicine, they have even smaller prices, and they consciously did it. And those programs will not be stopped. Abbott, for example, company, they sold all the medicine for the price of 2013. So the majority of companies keep their word, and it's only 8 companies. In this case, we speak about the list, which I should. They are monopolistic companies. It's not about the majority of companies, but the big number of them, not majority. They did that step, and the treatment progress and tender documentation shows that they keep their promises, but that's some percentage is important that all companies work like that. So the majority the majority keep the prices over 2013. We have such examples. One and the same company, just for you to understand that companies from pharmaceutical companies have a lot of medicines, and there are some preparations which have no alternative in Ukraine. For example, one and the same company, pharmaceutical companies, have the prices for some preparations lower than they had in 2013, but for some preparations they raised the price by 70% or 60%. Maybe that's how they decided to compensate. Merck Champendon, for example, there are some preparations they reduced the price, and for some preparations, 1/3 of companies they meet their promises. All the rest they don't. And they raised the price not just by 15%, but by 40, 60, 70%. So huge growth of prices. Thank you. Is there any question? I will answer the question about our plans. We expect that pharmaceutical companies will send their letters, and that's our plan. If that doesn't happen, then we have to understand we should start a real war against some pharmaceutical companies. One of the tools how to influence that can be through the reference prices, register of reference price, and a formula which will be approachable. There will be questions to the Ministry of Health. How they, what formula they will use? Will there be risks which will allow to have higher prices for medicine? We will try to influence on that. Also, we should involve if the anti-monopoly committee and price inspection for them to check whether there is justification for higher prices, and also they should check maybe there is a plot to raise prices, and because as to HIV and AIDS preparations, we buy medicine for 150 million, and in addition to tender, we negotiate with the companies for them to provide free preparations because our country is in crisis. We understand that the procurements by the Ministry of Healthcare is postponed. If the Ministry of Healthcare, we have a lot of questions to the ministry, and lots of examples of they are non-competent and no competence. They bought preparations to treat hepatitis virus, hepatitis, and they buy them. But the Ministry of Healthcare, with a supplier, they didn't buy one more ribavirin, which needed for interferon for side effects to be easier, and that medicine didn't come to the Ministry of Healthcare. There's people around Ukraine, they have to buy it, and that is very expensive. And there are a lot of such examples. That's why we'll continue working with pharmaceutical companies. We'll ask them, and we'll get preparations from them we need for the thousands of people to be to survive. There is no question. I would like to thank you. Thank you very much.
Да.